President Barack Obama took his health care reform plan on the road and to the people.
Hello, everybody.
This town hall meeting in Ohio comes at a time when Congress is struggling to agree on a way to pay for a plan to reform America's health care. The estimated price tag, $1 trillion.
I won't sign it if that reform adds even one dime to our deficit over the next decade. And I mean what I say.
The president is pushing for a plan that will prevent insurance companies from dropping coverage. He also wants limits on out-of-pocket costs. Bills in the House and Senate would require most businesses to provide health insurance for their employees. All Americans would also have to get health insurance. Discounts would be available for anyone who can't afford it. Cancer survivor Angela Kegler-McDowell says she can't get insurance even if she can afford it because of a pre-existing condition.
I'm too high of risk, so no matter how much I could afford, I cannot get insurance right now through our system.
You won't have to worry about pre-existing conditions because never again will anyone in America be denied coverage because of a previous illness or injury.
In a nationally televised press conference Wednesday, President Obama outlined his plans on how to pay for health care reform. He said 2/3 of the costs will come from reallocating government funds already in health care. He wants the rest to come from America's wealthiest.
We will pass reform that lowers cost, promotes choice, and provides coverage that every American can count on.
Republicans, like House Minority Leader John Boehner, oppose the president's plan.
This is not what the American people want. We believe it's time to throw this bill away.
Karen Kerrigan of the Small Business and Entrepreneurship Council said businesses may be forced to cut jobs or shut down if the president's plan becomes law.
The last thing that they need right now from Washington are more costs imposed on their businesses.
Republican Representative Eric Cantor said Congress needs more time.
I say that rushing is not smart and not acceptable for families across this country.
If there's not a deadline in Washington, nothing happens.
President Obama had originally pushed Congress to come up with a health care bill by the end of August, but he is now softening that deadline to September.
That's okay. I just want people to keep on working. And I want it done by the end of this year. I want it done by the fall.
Democratic senators and representatives aim to have one unified health care reform bill by October to have the president sign into law. Elizabeth Lee, VOA News.